You remember at school, the teacher used to give us a hot club.
Hey!
That is the commonest form of damage. Yes. They were not teaching us anything. They just said, hey, what do you want to become? A teacher, a police. I want to be a husband, a mother, a what?
Yes.
A security. So I stood up. I said, I want to become a doctor. She said, you're too stupid. We were the best trained doctors.
Wow.
That's why we could go anywhere in the world and still be the best. I did an operation in the minister's child. And the minister was standing behind me. You just wake up and said ringing, and you feel the ear is blocked, and all of a sudden you have nausea and vomiting, and you're dizzy. You must know that within 3 days, you must see an ENT specialist to give you steroids. If you don't do that, your hearing is gone.
You are credited as someone who's cured deafness.
Yes.
King David Studio podcast.
I'm privileged to talk about Kaizer Chiefs with one of South Africa's greatest innovators, in my opinion. You are the modern day Chris Barnett, as far as I'm concerned.
Oh, it's an honor.
I think you are. And I don't do lots of introductions, but I wrote something. And what did I say? Professor Mashudu Tshifularo, who's a well-known South African ear, nose, and throat specialist and innovator, an inventor in my world, head of otorhinolaryngologist at University of Pretoria, and also a renowned surgeon who's pioneered the world's first middle ear transplant in 3D printing. That's who we're talking about today. We're talking about someone who's changed the world.
Oh, thanks.
I'm
humbled.
Do you recognize the change that you've brought to the world?
Firstly, I was not aware, but when people start to comment, and at the moment, I got response from all over the world.
Yeah.
I usually tell people, I said, as far as Papua New Guinea, I guess you know where Papua New Guinea is.
Yes, I do. So it's everywhere.
So I say Papua New Guinea because it's one small island in the middle of nowhere.
You got a call from there.
Got a call from there, get their email from there. Even now, they still want to come. They say money is not an issue. So it's only now that I look back and I realize that, you know what, one has made an impact and one is grateful for what God has given you. And the opportunity to can make such an impact. It's not everybody, and we don't go out looking for that. But you just find that when the man above look for somebody, he put you on the spot. And it's going for 7 years now. And every time when I look, I said, whatever is happening is not as intelligent. You're right. I'm an inventor, an innovator.
Absolutely.
Because with due respect to the heart transplant, I mean, you know, he has 4 vessels. It's a vessel to vessels. We learn with the frogs. That's what we used to do at second year.
You dissect the frog.
Dissect them. We take out the heart. We put it there. We give it potassium chloride and beat. And then when we stop, it stop. We put again. And then we suture it back. So I'm not going to say, you know. I've been told off.
I'm about to as well.
Yes,
to say,
yes.
but you're not by any means downplaying that achievement.
No, not really.
Yeah.
But I'm just saying they are two different because this one is to think seriously out of the box.
Yeah.
And my colleague can still say, how did you do it? What is this? What is that? So I said, unfortunately, of the color of my skin. Otherwise, I will be very far. Street and hospital and money will come. But Aluta continua.
So there's no street named after you yet?
No.
Even in Venda?
Even in Venda.
Aye. What's wrong there? No, so we have to give you a street.
No,
I'll name that chair after you.
Oh, at least I'll be happy.
What else can we do? I don't have any powers anywhere else.
Yes. But I think the most important thing is that it has changed the face of medicine in ear, nose, and throat reconstruction. And it's just the beginning.
Yeah.
There are a lot of things that we're working on. There are a lot of things that I want to be working on in the coming 5 to 10 years.
Tell us about that day in March
Yes.
of 2019.
Yes.
It was on the 3rd?
It was on the 13th.
13th, yes.
1-3.
The 13th of March.
Yes.
Tell me about that day for you. When you woke up in that day, I imagine there was a lot of planning towards that day.
Yes.
And when that day came about, give me a sense of the type of man who woke up into that day and then the type of man who slept after the day was done.
What happened was, so we discussed the day of the operation.
Yeah.
After the innovation, I've tried it everywhere and I said, okay, it can work. Then I said, what is the day that I must choose that will have a meaning to me?
Okay.
So the 13th of March was the day that I buried my late mother.
Oh.
So for me, in honor of her, I said the 13th of March is the day. So when I woke the night before, I practice, I pray, I meditate. I woke up and by 7, I was at the hospital.
You say you practiced to the very last minute?
To the last minute.
Okay.
I ran the whole operation in my mind the night before. Wow. Because that's what you need to do. You plan well and, have an idea, or this can go wrong, this can happen, and know what to do. Mm-hmm. You don't get caught. So you plan to the teeth. And we even teach the student that if you don't know how to prepare and plan the whole thing and how you finish, then you are not prepared. So I woke up that day. But yes, in the morning, for some strange reason, I don't even know what I was doing. I end up talking to the Minister of Health. The Minister of Health, which is the Minister of Health now, Dr. Aaron Mutsaret.
Okay.
I don't know what I was doing. Or was it God or what? And then I said to him...
Was he aware of what was about?
No, he was not aware. So then I made him aware. I said, you know what? I'm about to do an operation that is going to be a groundbreaking and which is going to be known all over the world. But I did not realize how big it was. And then immediately he informed, he was in cabinet. He told the cabinet, the minister and the presidents, and everybody was aware. Then from there, when the carte blanche come, then they brought in the media. We had media briefing. The CEO was there. The MEC was there. Before the op.
Hey, okay.
That's when the minister was told in Parliament, when Pretoria, there in Cape Town, that such an op is starting.
Aren't you getting cold feet at this stage of there's so much attention?
Not really, because I've been a teacher for almost better part of my life. Since 1995, I dedicated my life to the public health. And I've trained a lot of young doctors, and I've seen a lot. So I don't have cold feet anymore. So, and one of the things that happened, I did an operation in the minister's child, and the minister was standing behind me. And being in the medical field.
Oh, the minister was in the medical field.
Yes.
Oh,
yeah. No. I mean, look, when you know your stuff, you just chill.
Yeah.
And then you go. So
that's true.
I didn't have cold feet, but I did not realize how big it was. It's only when I was busy working, and things are happening. All of a sudden I hear, when I finished, I said, wow, we just finished. I end clap. When I look behind, there were not less than 15 camera people. I said, where are these people coming from? Then that was the beginning of my life. So I went to theater as an ordinary Mashudu who is not known by anybody. And that evening, my name was all over the world.
The following morning, the Pretoria News called you a MacGyver.
There you go. I don't know. I mean, I might have done not less than 100 to 150, 200 interviews, newspaper, TV, radio. I've been everywhere.
Yeah.
And that's when I suddenly realized that, Mashudu, you are not yourself. You are for the people.
You are credited as someone who's cured deafness.
Yes.
Is that the correct description of what you've done?
It depends what the deafness was all about.
Okay.
So because when we define deafness, we define it in 4 parts. There is a conductive hearing loss. There is inner ear, which is the cochlea. Then there is perceptual.
Let's do that.
Which is in the brain. So I mean, this is just the ear. I see other things. So you can get damage to the eardrum.
Okay.
Or the small bones that gives you conductive loss.
Yeah.
So if that is the only problem, and I did what I did, then I've cured that deafness of that person, which is conductive loss. When is the inner ear, which is what we do cochlear implant, which is what I do. So if the person has an inner ear hearing loss, then we put cochlear implant, which is another form of curing the sensory neural hearing loss. If it's between the ear and the brain stem, there's something we called brain stem implant.
Okay.
If it's in the center in the brain where the brain cannot process, like they call it autism. So the person can hear, or somebody with a stroke, they can have a stroke, but they cannot articulate.
Sure.
They can see that you're talking, but they cannot hear. So that one we don't have a cure yet, but I think we're getting there.
Yeah.
So I've cured certain part of deafness.
Let's go. Let's stay there with the
Yes.
types of deafness.
Yes.
Let's stay there. If there's anything you can demonstrate, by all means, which is why we brought that.
Yeah.
But let's stay with the different types of deafness.
Yes.
You're saying what? There are four.
Therefore,
One that has to do with
conductive.
conductive is information that comes from outside.
Exactly.
Is that the first level? Can we even call it that? The first level of the first type of deafness?
That is the simplest level.
Okay.
Because the sound comes from outside.
Yes.
And physiologically, so it comes as sound. Then when it gets into the middle ear, it becomes mechanical.
Okay.
When it goes into the inner ear, then it becomes electrical.
Whoa.
From electrical, then it becomes sensory.
Information.
Information, which is processed in the brain center. And in a nanoseconds, the whole brain,
knows what you're saying. My brain
and
knows
reply
what you're
at
saying.
the same time.
Yes.
And it goes both sides. So it's not only one side. So both sides of the brain, they interpret, they understand, and I reply spontaneously. Amazing. That's how the creator is.
Yeah.
So there's no pause in between.
No.
So if you have conductive, so either we say, look, I cannot hear because my ear is full of wax. So the whole external ear canal will be full of wax here.
Okay.
It blocks. Then the person goes and take out the wax. Then the person says, oh, now I can hear.
Okay.
Then,
So it's almost like you put something on the ear.
Yes.
Okay.
So we remove whatever is blocking you.
Yes.
Then you can hear. Right. Then there's a membrane. So if the membrane is damaged, there's a hole. The sound cannot go into the middle ear and inner ear. Sort of like it gets lost. There's distortion. Then we go and repair the eardrum.
That's the second level.
That's the second level,
Yeah.
so to speak.
Yeah.
Then the bones now, those three bones, which are the smallest bones in the body.
Are they there?
Unfortunately, I don't have them here.
Oh, yes.
But they
meant
sit
to be.
here.
Okay.
They're meant to sit here.
They're tiny.
They're tiny.
How small?
Like the size of a rice.
Whoa.
So when you are eating a rice which has not been cooked, that how small the space is.
Wow.
So you need big magnification. You need steady hands. You must be patient and you must be gentle. So that's why we call it microsurgery. So you cannot do ENT if you are not gentle. You have to be gentle with the tissue. Because any small mistake can be disastrous.
Let's go back to that bone.
Yes.
What other type again of deafness we're referring to?
So until those bones, so the outer ear, the middle ear, that is conductive.
And how can they be damaged? Sorry, I interject. How can they be damaged?
They can be damaged by trauma.
Okay.
Or you can be born with them without them well developed. Or you can get damaged by infection, which is the most cause. So when you have pus coming out of your ear, or they can be caused by things like tumor, where it grows inside and eat the whole bones out. And then sometimes we can cause them by, you remember at school, the teacher used to give us a hot club.
Hey!
That is the commonest form of damage. Yes. Can just clap it and
you can't hear anymore.
You can't hear anymore. So the worst thing with that is those small bone, I call them, they are almost like a brake system.
Okay.
So they control the amount of sound that go into the inner ear. Because the inner ear cannot take anything more than 120. You are in the sound
decibels, yes.
decibel.
Oh,
anything
no.
above 120 is going to destroy your inner ear. We're talking about soccer now.
Yeah.
And you remember the vuvuzelas? There was a time where I wanted to do a research. I said, I wonder if you can go and test all the coaches. First, you test their heartbeat and you test their hearing. Because those vuvuzela are loud. And
why does the heartbeat play a role in that conversation?
I mean, there's a lot of anxiety and emotions and kicking chairs and screaming and shouting. So their blood pressure will go high.
Yeah.
I don't know if anybody have done that. Maybe I've not read the study. But the hearing was very interesting for me to say, if now you have a stadium full with vuvuzela all the time throughout the year, we test in the beginning of the year, maybe we in the middle of the term, and at the end of the term and see what happened.
What? You can still do it.
We can still do it.
I'll tell you, I'm exposed to a lot of noise. I try my best to give myself enough gaps between these noises.
Yes.
I DJ on weekends. I wear headphones most of the day.
Exactly.
We're recording this in the afternoon.
Yes.
I did a radio show. For 3 hours, I had headphones on, better part of that 3 hours.
Yeah.
And I'm told by my colleagues that my headphones are louder than the average person.
Yes.
They're already starting to doubt if I can hear properly. I think I'm fine. You think
you're fine?
Yeah.
Until I test you.
Of course. Of course. But I prefer a louder noise in my ear. I enjoy the music louder. Let me just say that.
I'll test you for free. Because
I'm nervous now. I'm not sure I want to. So that's why I know that and then on weekends, I'm exposed to noise when I go DJ at different functions. And I would put on headphones naturally, and there'll be a speaker next to us, and we're playing, and it's noisy. Even my watch tends to tell me that, be careful, it's a noisy space. It lasts for about 2 hours, and then I'm back to silence. When I drive, I almost play nothing. I play audiobooks half the time. I would listen to my colleagues on radio, but it's very, very low. So I don't know if these high moments and low moments make any difference at all.
It's very normal. So what happened is the consistent high sound decibel of more than 80 dB into the ear, and for 8 hours non-stop, let's say like minors. So when they do occupational medicine, so they encourage them that they must be there and have an hour break. Because, if you are exposed to a very loud noise, for you with headphone is even worse because there's no escape. The space is small. I'm sure you can tell if you have been using them the whole day that you have earache now. You have headache. You have tension headache. You are irritable.
You have a sound.
So that sound, it's telling you that the inner ear, which are made of tiny hair cells, like corals. You see those in the sea?
The water, yes.
That's exactly how the hair cells are. But they are tiny, minute millions.
Wow.
So when the sound comes, it hit them. So if it hit one over and over, like your finger you are hitting, after some time it feels pain. Then it will start to give you the abnormal sound. Then you start to have tinnitus.
So it gives you this, it'll come in different sounds, either high pitch to low pitch, but it'll be continuous.
If it's continuous, that's a problem. Usually it's high sound, so we call it noise-induced hearing loss. So it's like you are hitting one place over and over again for a long time. You are going to start to lose the functioning of that hair cells.
Is that repairable?
Unfortunately, no. What you need to do is that you need to have a lot of rest. So what you're doing right. When you drive, that you're not exposed to the loud noise, and you're relaxed, and you're not allowing yourself to use loud noise. You are doing very good because you need to rest that nerve. If you keep on hitting it and hitting it and hitting it, and all of a sudden you find that every time when you talk with people, you are very loud, you must know there's a problem.
because you think you are hearing yourself first.
Yes.
And then
you can't hear yourself. You think somebody else cannot hear. That's why a deaf person, they will be very loud when they speak. Because they think you can't hear. They can't set the tone.
True.
You and me, we can set the tone. Okay, let's be soft. With them, no. So they'll be louder. So we always laugh in medicine. We said the elderly couple, the husband will say, my wife, I've been calling you that I want tea, I want tea. Then he goes to her. He said, I've been calling you. She said, the first time you called me, I answered you. It means that the husband does not hear.
He's the deaf one.
He's the deaf one.
Not the wife.
Not the wife.
She's just not interested in making tea.
So noise-induced hearing loss is you need to rest. So you're lucky because you're there for 3 hours and in between you're resting.
Yes. And also it's not a continuous headphones. I put them down and
fortunately,
talk to
so
colleagues.
If it's continuous, then it's a problem. And if it's in a contained space, there's nowhere where the sound goes. It goes inside, tympanic membrane, going into ossicle. So I would say God created some muscles inside that when the noise is too loud, it tenses
shock absorbers.
Shock absorbers. So it tenses those bones so that the sound must not go inside.
What?
Because the ratio of the eardrum and the oval window is almost 31:1.
What does that mean?
It simply means that instead of 1:1.
Mm-hmm.
So it's 31, in other words, in size.
Okay.
It's a pinhole.
Yes.
Let's say on a 1 cent coin.
Mm-hmm, mm-hmm.
So
relative to 31 pinholes, so to speak.
Yeah. So it's 31 in size, which is supposed to go through that small hole.
Ah, got you.
So there's traffic jam.
And that traffic jam is good.
Yes.
Because
it gives you loud sound and then you can hear. But when it's too high, then the muscles pull so that not too much noise must go
Let's use the same example. I like it. Now there's a roadblock.
There you go.
JMPD are slowing down traffic.
Yes. 4 lane into 1.
Aha.
So now for the ear, now you have most probably 10 lane or 12 lane. They are going into 1 lane. So which means that...
And that just happens.
Physiologically. So it taking all the sound and then it maximizes it to one place. That's why sometimes we hold the ear like this because you want the loud sound to come so that it goes in and you can hear. But animals, they have their muscles are well developed.
They close, they open. I know with my dog, it'll sit looking at you.
Yes.
And then it'll do this with one ear.
Yes.
To the right, to the left, and to the right. So that skill, animals have done that. We can't do that. Obviously.
But the dogs, they hear higher frequencies than us.
Yeah.
So ours that we can measure, they go up to 8 kilohertz, but most of the time we stop at around 4 kilohertz.
Okay.
Anything beyond that we can't hear.
So
with them, they go to 20 and 30, like the fish, the whales.
Yeah.
They can hear that sound. Like the elephant. So the size of the elephant ear is not for decoration.
It actually has a purpose.
It has a purpose.
So they can hear a pin drop.
They can growl and pick up that sound. I'm sure you're aware that the snake does not have an ear.
It doesn't.
It doesn't.
It senses through...
It picks up vibration.
Vibration, yes.
Yes, like fishes also.
Yeah.
So they can sense vibration, and sharks. So they can sense vibration, make in their mind, how big is this thing that is coming, and how must I approach it, how far it is. So they don't need to see, just by vibration only.
Good enough.
The brain will be able to tell them that this is the size and this is the strategy I must use. It's amazing.
It is.
So that's why when people say there's no creator, we're just discovering. For me, I said we were supposed to appreciate the creator more than, because anything that he has created is just super fantastic and perfect.
It's incredible.
Amazing.
I want to go back to the 13th of March.
Okay. Yes.
How did you find Thabo?
He was one of our patients who have been coming.
Okay.
And then we could not afford, the processes that we were buying because with rand exchange, and so the hospital and the government could not afford. So I said to him, look, I'm trying this. Are you willing to be a patient? You are not going to pay anything. I'll pay everything for you. He said, no, Prof, all what I want, I just want to hear. Anything, I'm willing.
What brought him to that place of not hearing?
For him, unfortunately, he had an injury, he had an accident, he had infection, and he was operated before. It did not work. So ideally, I was working with a very difficult patient. We always want to work with a simple one.
Hey.
So if you have had an accident, you have been operated before, you have had infection, that is not the best patient you must start with.
But you still chose him.
Because he was willing. I said, Thabo, I don't guarantee what is going to happen. You might hear or you might not hear. And on top of that, you're going to be asked a lot of questions. You'll be on the media. Are you willing? He signed the consent and everything. He said, no, that's fine. I'm willing. And everybody knew that he has volunteered.
What level of deafness was he going through? Complete nothing?
He was at the level of almost what we call moderate to severe.
Okay.
Because when you lose all the bones, then you go to moderate, which means the level that you and me will speak is 60 decibel.
Okay.
So once you start to lose beyond that, 60 to 70, you cannot communicate anymore. So he was complaining, look, I'm losing my job at work. My boss are angry with me because I cannot hear. So I said, please, Prof, just do something.
Anything?
Wow. And I thank him. Still a friend till today. He really changed my life. But I did not realize that was the first in the world.
How is it that you didn't know that?
How can I put it? So with all this research and studies, I'll see what they were doing. I thought maybe somebody has done it. Maybe I'm not aware, has not put it in the publication. So when I did it and we researched everybody, till today they realize that no one has done it. No one has done it.
Yeah.
So, and it became the easiest thing because now it's easy. We take your x-ray, we recreate your bones, and they look exactly like you. If it's for the king, it's for the king.
Hey.
It is not.
Mine would be in gold.
Yours would be in gold. We'll do it in gold.
Wow. And once, how long was the surgery for?
The surgery took me 3 hours.
Okay, it wasn't a long 18 hours.
No, not really. So yes, I was, meticulous. I'm going. So as I was moving and I was cognizant that everybody's watching. But yes, you are used to student when you teach. So I was a bit relaxed in that angle, but I did not know what to expect. So I was just moving. I said, okay, I'm moving. And then when things works the way how I anticipated, when I finished, I just said, wow, we have done it. Then I just said, head clap. Then I realized, oh, wow, what have I just done? But even then, I did not realize
the magnitude.
The magnitude.
And with his operation, was he completely out during the operation?
Of course, he's under general anesthesia. He's completely out.
Yeah.
He doesn't feel the pain. He doesn't feel anything. And of course, you do it in theater, sterile with the sister and everybody is there. So it's only when he woke up, then he started to be surprised. Everybody is asking him questions. It's all over the TV. It's everywhere. He's being invited.
But do we know that he can hear at this stage of him waking up?
Yeah. Oh, you mean when he was still asleep?
Remember, when
he was still asleep, I did not know that he could hear. So when he woke up, of course, he was bandaged. So I waited for him the small tests that I can do. So I do small tests on him. I said, can you hear? He said, yes. So I knew he can hear. But I did not know how much can he hear. So when he completely healed, then I said, Thabo, what's up? He said, man, Prof, I'm sharp. Thank you so much. I can hear. I've kept my job. I can hear you. I'm doing my job. So everywhere where he goes, he was fine. He didn't need any hearing aid. He didn't need anything. So I said, oh, Thabo, you have really made we have made history together.
Yes.
But by that I was say in honor of my mom, and till today I said in honor of my mother.
And I'm really curious because that moment, it's almost like that God moment in the Bible where somebody couldn't see and now suddenly they can.
Exactly.
Those things remain biblical and magical.
Yes.
I've always had the belief that there's a phrase that says Jesus, all he wanted was to demonstrate to all of us that what he can do, we can also do.
You can say that right there.
And my logic about it is, well, the ability to wake the dead rests with doctors in the moments where they resuscitate you.
You are very right.
And you come back to life again.
Right.
And
yes.
that is another moment of that where somebody could not hear.
Yes.
And now you brought them back. You brought their hearing back.
Yes.
And that's exactly that, isn't it?
It's exactly that. And for me, because I'm very spiritual, and so everybody knows, I'm a man of cloth.
Uh-huh.
So most of the idea, they just drop in my spirit. I said, what is this? So the idea just come when I least expected. And when I finish, I just said, look, to him be the glory. So before I do any op, I pray. So if I'm about to operate you and I feel in my spirit that, no, something is not right, I'll give excuse.
What?
Or I'll tell you that, please just go and sort your things out and pray. And then when my spirit said yes, then I go.
That's
so I've
cool.
been lucky for so many years, more than 30 years. I've not had serious mishap like losing somebody on the table. No.
Yes.
I've been blessed.
Yes.
Because now I'm more sensitive. So if I'm about to do anything, I pray. I don't do it like show people. No. I'll be praying in my heart and I'll be discerning. And when there's emergency, then I will open my mouth and speak. I don't care who is there. Because it's what I believe. That's what I believe in. And for my age, there's nothing that I can change. This is what I believe. This is what has sustained me for all these years. And it has worked for me.
Tell me, though, while we're on this subject, what type of prayer do you pray in those moments?
In those moments, the prayer is that, of course, you pray that may the operation go well. And then even if we have a complication or any difficulties, please guide and help my nurses, my anesthetists, and everybody who's looking after the patient. Please, we don't want to lose the patient. And I must be able to sober and find the solution. So you pray for that. The great physician, which is Jesus Christ, must be using your hands to do the operation.
Yes.
But at the same time, you listen to him communicating with you in your spirit. Immediately when you feel something is not right, I've done it not only once, many times. I'll give an excuse. I'll just say, you know what, the machine I was waiting for, it is not here. Do you mind? Let's postpone the op. And then the patient will just say, oh, okay, Prof. I said, I'll tell you when to do it. Because my spirit was not at peace.
So you do listen to your, as they say, we listen to your gut.
That's what I live on. I listen to my gut all the time.
What do you recognize it as? That feeling?
I recognize it as a guardian angel. So I recognize it as an angel that guides me. Sometimes he can tell me that, look, don't go don't go somewhere. Stay indoors.
Don't jump.
Don't leave
bridge.
the house.
Yes.
Or you are driving, said, please don't go this road. I won't go.
Wow.
So it's amazing. But once you reach that space, it's the best place to be.
Do you think that God exists with all of us, or it's exclusive to certain people?
All of us will have it.
Yeah.
Like I'm talking to you, you are responding. Why are you responding? Because I'm talking. So in other words, you reach a stage where you suppress the God. All of us we have been given a measure of faith and a measure of the God to communicate. So if the God said no, and you don't even know, you don't have to know why. Just the fact that
you feel it.
You feel it, you say no. You just say, the question why is a stupid question. If we have to say, why is the robot red?
Yes.
And you decide to say, I'm crossing it even when it's red. you are foolish.
Yeah.
Because for somebody to be green and it's going to hit you.
True.
So when you say no, you said, okay, look, I'm stopping. And you tend to live that way, and you tend to feel that you're getting communication is continue all the time.
And it doesn't ever stop, this
It
communication.
doesn't stop. It doesn't
Even
stop.
when you ignore it.
Even when it doesn't stop. Even when you ignore it, it doesn't stop. So you'll be just surprised. There are times maybe for me, I might just feel, okay, you know what? Let me send my friend so much money. And then my friend said, how did you know that I wanted money? I said, no, don't worry. I was told.
It was a communication.
It was a communication.
But sometimes we give the wrong friend money.
Of course. There are some that when they ask me, when they ask me what I say, I said, no, you know what, I'm going to go discuss with my financial manager. If I say that, I know that you are not going to get it.
The gut says never.
Yes.
Wrong one.
And if you want to fight with the family, you must play with money. So when you give them money, know that you are not going to get it back.
That's a tricky one.
So if I know that, okay, a family member want money or a friend want money, and I don't mind, I don't want it back, I'll give it to him and let it go.
You accept.
I accept.
As this is a gift.
Yes, it's a gift.
Let's talk about medication. I've read somewhere that speaks of certain types of medication can affect hearing.
Exactly.
Help us understand that.
So there are some drugs or antibiotics. We call them drugs for us, not but official drugs.
Yeah, of course. We know the difference.
You know the difference.
Pharmacists are drug dealers.
Exactly.
That's it. We know the difference.
And let alone us who are surgeons. What are we? We're worse.
You're mafias.
And we get paid for it, So that's why when you have a problem with the kidneys mainly,
okay,
because all these things have to be metabolized in your body system and released by the kidney and the liver.
Okay.
So if you have a problem with the liver and the kidney that are not functioning well, there are certain drugs you cannot take. Okay. So there are drugs that we use like, so some they are permanent, some they're sort of like temporary. Let's say if you have a high blood pressure, there are drugs that we give that we call diuretics. They make you to want to go to toilet all the time. Those ones, they can suppress your hearing down a little bit, but when you stop, the hearing comes back.
Help me understand how.
Because the complex of the organ of hearing that we call the organ of Corti, it has something called basement membrane. It needs good blood supply. So when you take out a lot of water, you are not sending enough blood into that membrane. Some of them, because when you take the medication in your system, it goes to any part of your body. So some, they go to that ear and bind on that sensitive area that we call basement membrane. But it's temporal binding. Then there are some, like we call it aminoglycosides. We use them a lot in the ear drops, and we use them a lot also when in somebody with kidneys, called the drugs like gentamicin. There are some that we use for TB. So if you give the patient those medication, some you tell them that, my friend, it's either you are dead with a good hearing or you're alive with a damaged hearing.
Yes.
We'll see what to do thereafter.
But you're saying some are temporary. They're not
Yeah, some
permanent.
are temporary. So the thing like diuretics, then they can drop them a little bit.
Okay.
There's another antibiotic called erythromycin. It can drop it a little bit. We call them quinolones. So the doctors, they will know which one are which. And those gentamicin, kanamycin, neomycin. So anything which is CIN is dangerous.
Yeah.
You have to have a good functioning kidneys. If your kidneys are not functioning well, it will destroy it. If you have a perforated eardrum and you put it there, it goes straight into the inner ear and it kills the ear.
Oh, no.
And sometimes we use them when the patient has a lot of dizziness.
I wanted to find out about, I have a friend who has fallen because of their hearing.
Yes.
How does hearing and balance connect?
They are very connected.
Okay.
So even the nerves that we call it vestibular nerve and cochlear nerve, they are very close to each other. So there's a certain condition that we call manias. So to put it simple, the inner ear, it get filled with too much water. So there are people that when it start, this dizziness or we feel things are spinning, it knocks them, they fall down, and then from there they wake up. So, but falling can be from many things. Sometimes it can be from the heart.
Ooh.
It could be a stroke.
Yeah.
It could be like maybe you did not eat enough. You are hypoglycemic. You have been standing for too long. So there's
Or you stood up too fast.
too fast. Then you have hypertensive spells, and you take the hypertensive medication that drop your blood pressure very low. So you don't have enough into the brain. Therefore, you will feel you're tired, you're weak, or you're anemic because even when you're anemic, your blood is weak. It's like water.
Oh, yes.
So for you to get enough oxygen, you need too much blood.
Yeah.
So that's why now the heart is pumping until it said, no, I cannot do it anymore. Then you have heart failure. But the hearing, the cochlea, we call it vestibular cochlear nerve. They are close to each other. They come from the same nucleus and they run together. So that's why you can have deafness. So there's something that we call it sudden onset sensory neural hearing loss.
Okay.
So it's like a stroke. So you just wake up. You told me about ringing. You just wake up and said ringing, and you feel the ear is blocked, and all of a sudden you have nausea and vomiting, and you're dizzy. You must know that within 3 days, you must see an ENT specialist to give you steroids. If you don't do that, your hearing is gone.
What will steroids do in that regard?
Steroid is a magic muti. We don't even know what it does.
Well, ask bodybuilders, they'll tell you that it's magic.
That's what it does. So it does neovascularization, and then it opens the vessels and promote blood supply.
Okay.
So we hit the patient hard with steroid. Must give it for at least 6 weeks.
So to send blood in that direction.
To send blood in that direction. That's when we can have a chance of 70 to 80% to save your hearing and restore it back to normal. So when COVID came, most of people had that. So the viral infection, it knocks the hearing, and then we have to give them a lot of steroid. But you need a doctor who will be able to identify quickly. So we tell our training young doctors that immediately when you have ringing ears and you feel blocked, you feel nausea and vomit, the patient is feeling dizzy, and he can tell you to say precisely on this day and on this time, I just had like a strike and my hearing disappears.
Whoa.
Then we know that it's a sudden onset sensory neural hearing loss. Which you can simply say you had a minor stroke.
That's it. That's what. How common is that?
No, it's very common. It's very common.
And it just happens suddenly.
Just happens suddenly when you don't even realize and you are not even aware. But the patient will tell you precisely. They are specific of the time and the date and the place.
That's crazy.
Yes.
Wow. Pregnancy
Yes.
and hearing loss of the fetus. Is that something that exists? That's we're preparing for this. I had to research and I found that out. Yes.
Yes.
That a child can lose their hearing before they're born.
Completely. So that's why when the mummies are pregnant, as soon as they're pregnant, there are certain medication and drugs that they're not supposed to take. Because as they're taking into their system, it goes straight to the babies. So sometimes we even go on and talk about allergy. So the kids get allergies from their parents. If you're allergic to peanuts and you continue to eat them and you're pregnant, that baby might be born with peanuts allergy because they're getting sensitized before they're even born. So even the painkillers, we don't give all painkillers. Once you're pregnant, you can take only Panado, and at the most, you can take only the amoxicillin or penicillin.
It's very low dose.
It's very low dose. And they're taken as more safer to the baby.
Okay.
But you take any other strong painkillers and antibiotics, they used to take things like tetracycline, going to damage the whole child, let alone in the first 3 weeks.
Wow.
That child will be born with damage. And it's worse because even drugs and things like drinking, alcohol, you get so-called fetal alcohol syndrome. Babies.
That's a bad one.
That's a bad one.
Fairly common in South Africa.
Exactly. And certain part of the country.
Yeah.
You know.
Let's
you must not say it in public.
No. It's our dirty secret.
Yes.
Yeah, you're now exposing us.
So the babies in the mother's womb, they are very sensitive. That's why when the inner ear is the first organ to mature. So that's why when you are angry, the baby keeps quiet. In the tummy.
Whoa.
When you are happy, the baby kicks and kicks and kicks. When you play music, the baby will jump or lie. So you can make the baby listen to music.
In the belly.
Yes.
So you're saying of almost all the organs.
The first organ that matured is the
hearing.
Cochlea, the hearing. 8 weeks of life.
What?
Yes.
Let's go to the spiritual world now. I can't help it. I'm with the
I know.
And we can create any reason.
Okay.
Let's do that.
Okay.
Why did God make us hear before we do anything else? Because everything that happens in the tummy is in the dark. But we are able to hear the world outside.
Exactly.
By the time we turn 8 weeks.
Yes, so the child can hear the mother's voice and the parent's voice. That's why it's amazing. That's why I said the way how God is amazing. Any mother will tell you, if there are kids playing outside and their child scream, they will know that that's my child.
Yes.
I'm sure you have seen penguin, you have seen, sea lions and things. They can just make sound and they know that that's my baby. And the baby knows that is my mother. It's amazing.
That noise, and I call it that for lack of a better reference, but that signature sound is embedded
in the brain.
Right in the beginning of life.
Of life.
Wow.
So they will know when the mother speaks. And amazingly is that when we have any problem, none of us said, Papa. We said, Mama.
We do.
And even the language, they don't say it's father's language, it's mother tongue.
Mother tongue.
So that's why fathers, we have to just support our children,
Yeah, just make sure you're there.
We are living in
You may not get anything out of it, but make sure you're there. Wow. That's an interesting one.
Yes. You don't hear Papa. No person say Papa. They say Mama. And some of them, the first language, the words they utter is mama. Maybe there's milk.
Yeah, that too. That too. And does it at any point stop developing this, the makeup of what makes the hearing? As a child is in the tummy, developing, other bones are getting stronger. Does it get to a point where now the ear is done? What makes the ear is done. At what stage is that?
5 years of age.
Oh, it's not born ready.
It's not born. The other part of it are born ready.
Okay.
So we look for what we call the mastoid. So it expands to the maturity by 5 years.
Okay.
So that's why when we used to deliver babies, we used to use something called forceps delivery. We used to damage the nerve called the facial nerve.
Ooh.
Because the bone is not fully developed. And
because
the
of
nerve
that process.
Yes, and the nerve is sitting outside.
Oh, no.
So by 5 years, the ear is fully matured to an adult age. So it will just grow with the skull, but it is fully formed. But by 8 months, the whole organ of Koti, the inner ear, is fully set.
Yeah.
If you start to take drugs around that time, you can disturb that process.
That growth process.
The same like the opening. So you find that the ear genetically or because of medication is not open, the earlobe is not developed, such kind of things.
Let's rush straight to the end of life. Very careful words I use when I say end of life, because some of us die of old age. Yes. Does it deteriorate with time?
It does.
Naturally?
It does.
Yes.
It does.
Does hearing age? And
no, it age. It deteriorate. Huh. So from around like when we talk, everything degenerate at certain age. So there's genetic, then there's normal degeneration.
Okay.
So there are families that when they turn 20, mid-20, they
What?
start to lose their hearing.
Oh, no.
Then there are those who are just normally, let's say, they have other comorbidities, high blood pressure, diabetes mellitus, high cholesterol. Cholesterol is one of the bad killer for the hearing because the blood supply for the inner ear is only one artery. So if it gets blocked, you can't hear. So that's why we always say, please check your cholesterol. Yes. So others, you find that other things environmentally, they will affect the hearing. But like vision, from some people from normal growth, from 45 years onwards, then it start to get weaker and weaker and weaker and weaker. That's why when you talk to your grandparents or your parents, they have lived long, was 70, 80,
yes.
they can't hear you. And they said, what? And they always feel you are scattering about them. So we call it old age.
Because they think you're speaking low, and you're not.
You're not.
They just can't hear
you're
you.
whispering about them. So it does, there's degenerative hearing loss. So with degenerative hearing loss, depending how bad is it, then you can use hearing aid.
Okay.
So you can use hearing aid to a certain extent. So there's a level that hearing aid cannot work anymore.
What?
So if the hearing is more than 70 to 80 decibel loss, even hearing aid won't help. So now it becomes painful when you use it. That's when we go for cochlear implant.
So cochlear implant is not automatic.
It's not automatic, no.
It's not first option.
No, it's not first option because the device is expensive. The smallest tiny witty will just not less than a centimeter, a few millimeters.
That grain of rice.
Yes. It costs not less than $250,000.
Oh,
so you can
no.
buy a house.
Oh, no.
Yes. So in this country, we usually get a team of specialists from different fields, audiologists, speech therapists, psychologists, occupational teachers, and then ENT surgeon. And then also the company, the rep that represent the device. So they have criteria for everything. Then we look at everything until we say this is the best for this
All
patient.
those options.
All those things must be ticked.
Before we get there.
Before I have to put a cochlear implant.
Before they call you.
Before they call me.
Yes,
So we must have ticked everything.
Yeah.
So I can't but the main thing is to protect the patients. Because the device is expensive. But it is well known that if you implant a child within a year, later within 2 years, that child will develop language and hearing like any other child. I'm sure you're aware that the current Miss South Africa, she is a cochlear implantee.
I didn't know she was implantee. I knew that she was
deaf.
Yes.
No, she has a cochlear.
Ah, okay.
So then they perform like any other person, as long as they were implanted when they were still young, so that they start to develop language like everybody else. Wow. So there's what we call prelingual and postlingual. Prelingual is before you start to speak, to have your computer store anything. We are speaking English because we have a bit of vocabulary. So if you don't put anything on that mother body for 5 years, that mother body dies. You cannot put anything anymore.
It switches off.
It dies completely. The cell don't develop. If we don't disuse dystrophy, and it dies.
I think it's pretty normal, I guess. Muscles work like that.
Exactly.
If you don't use them, you lose them.
You lose them.
So it's what is it? What do they call neural pathways?
Neural pathways, and they don't develop.
They don't form.
Die. So the more you stimulate, the more they develop. The more they develop. The more they develop. The more they store. The more they have memory. So like language. So children at that age, before 7 years of age, their brain is like a plastic, like a sponge. It can take it. Kids can learn many languages at the same time at that age.
Yeah, I know one like that. That's why
we at this age we struggle now to
learn a new language.
Yes, those boxes are
learn a new
filled.
thing.
A new thing altogether.
Yes.
Those boxes are filled.
Jeez.
But at early age, the boxes are still empty. And they will know that this goes there, this goes there, this goes there.
I know a child that speaks Afrikaans, Zulu with the kids outside in the street, Afrikaans with the people in the neighborhood, because it's an Afrikaans neighborhood. And they speak Sesotho with the grandma, because that's the language she speaks, and very deep Lesotho. And they also speak, street lingo with some of the kids. With some of the kids in all of, and obviously English because they go to school. And they're able to build all those
French and whatever.
They'll take it.
They'll take it.
Jeez.
So the brain is it's an interesting organ.
But you're saying the development of speech in that regard comes from hearing it.
Of course. So you have what you call memory. So once you say Mashudu, it's ingrained in my brain. So next time when somebody say Mashudu, I know about it.
Yes.
But if I've grown up, even in psychology, so if you don't have any memory for anything, that's why after the accident, you lose all the memory. We said you have amnesia. So in other words, you have shook the center so much. Then you have to redevelop again the memory. You have to redevelop the memory. But we
build it again. Build it again. Build the building blocks again.
And then something else might happen. You said, wow, this thing reminds me. Then somehow then the memory comes back.
They're reconnecting.
They're reconnecting. But the ladies, let me be allowed, I'm not being sexist, they have far much better memory than you and me. Males.
I know that for sure.
And they know how to triangulate. So you can never lie to a woman. Because they will ask you one thing 4 times in different format.
Wow.
And then they'll say, but last time you said you were with Mashudu. The other say you say you were with Joe. The other say you said you were with Manuel. Which one is which?
You forgot.
You forgot.
But they didn't forget.
So the truth is the best way because the truth does not lie.
No, you can't.
But the lie you have to remember. What did I say last time?
And we have a bad memory.
We are the West.
Wow, I didn't know that. I didn't know that the women naturally have a better memory than men.
Yeah. Oh, women, they're smart. They'll ask you one thing 4 times. And when they finish, they make their conclusion.
Yeah.
And their intuition are also very strong. Of course, they are not made.
Is that gut?
Yes, of course, they are not made from the soil. So if we go to the Bible, so maybe it's the better part of us,
Hey.
They're special. They make the world go round.
They took only the best parts.
You see what I mean?
Yeah.
So they're super. And even in the class, when they beat you in the class, you can tell whatever you want to do. They'll beat you every time.
That's crazy. Interesting. When I was growing up, the best performing kids in school were always girls. It was never boys. Boys got better with time, I realized, but not in the beginning.
No.
Yeah, boys had to work twice as hard.
Telling you, it's just resilience and hard work and hard work and hard work. And now you start to burden them with motherhood.
Hey.
And you must respect them because now they are career. They go home, they must be mothers.
And
on
wives.
top of that, they must be wives. Oh, man, they have some super brain, these people.
Jeez.
I respect them and honor them.
I want to talk about earbuds. Earbuds are in the bathroom. We treat them as something that we use to clean our ears. They're a big industry. And you, as someone who works in the space, do you think we need earbuds?
Actually, we call them cotton buds.
Yes.
Because they are not only for the ear. You can use them for anything.
Okay.
So, unfortunately, anyway, it's not. I'll talk not here on the public. They are not properly designed. They are 3 times the size of the outer ear. And they're straight.
They're bigger than they should be.
Far much bigger.
Show us if that can.
So the ear.
Yes.
This is not a normal anatomy.
Yeah.
It's not straight.
It's not a
It's not a straight
it's not
line.
a straight line.
It's an S shape.
So that is not as normal as it actually is.
Exactly.
This description.
It's not normal.
Yeah.
No.
Okay.
Next time I'll make it black. Don't worry about it.
It's
So
okay.
it's not straight.
It's
The
a
earbuds are straight and they're too long. So that's why when you use them, they push the wax inside. And if somebody bumps you, so the kids, they see the grannies putting it here, and then they put that, they're playing, they're jumping on the bed. The next minute, it goes in, hit the tympanic membrane, small bones into the inner ear.
yeah.
So they can even lose their hearing just by that injury. So it's almost like, what do you call this? It's a chain reaction. So one hit the tympanic membrane, the small bones, and the inner ear, they start to bleed, dizzy, they collapse, they lose the hearing.
Do you know, hearing you say that makes me question why we have contact sport, one. Two, the type of sports where people are hitting each other, from boxing to you name it.
Yes.
Because you describe it as something that sounds so sensitive.
It is.
And yet, if Mpama can damage it completely,
Yes.
and if you're getting Mpama all the time, that's quite dangerous.
You just need one. The thing is, there's no space which is not occupied. So even here, even if we can't see, there is something here.
Yes.
So in the ear, outer ear, the whole outer ear is full of air.
Okay.
So the middle ear is full of air. The inner ear is full of fluid. So when you hit, you are pushing the pressure that is filling the outer ear. That pressure push the physical eardrum and damage it, and it just continues.
As you said, it's a continuing process.
Yes.
Once one falls, the rest
it's
will
domino
unlikely.
effect.
Exactly.
So the what we call the temporal bone or the cochlear bone is the strongest bone in the body.
What?
So when you get injured or accident, it's not easily damageable
Okay.
to protect that important organ.
Yes.
You can crack the skull
And it stays.
and it stays. But this, we call it otic capsule.
Okay.
So that's why I said I respect the creator.
And you're saying that stays, but some elements around it are likely to be negatively affected.
Exactly. Some around it are likely to be damaged. But the same organ that matured first is the same organ that is the strongest.
Jeez.
That is not easy to crack.
Yeah.
Yes. So a person can have an accident and we find that that bone of that is intact. There will be those who crack, but by and large, it will remain intact. So we call it otic capsule fracture or otic capsule sparing temporal bone fracture.
Yeah.
So it can damage all other things, but that organ, it will remain contained. Where the inner ear, the hearing is, the cochlea, the shell, it's like the shell. You know, the snail can die, but the shell will remain.
for years.
For years.
Huh.
So that's how the cochlea, the inner ear looks like. So when we put the cochlea inside, we put inside that shell. Amazing.
You keep referring to it as inner ear. There's middle ear.
There's middle ear, which is where...
Which is different from inner ear.
Yes.
Okay.
Which is where
your area of...
my area of interest, by and large, is where the three smallest bones are. Malleus
But
and Cousin
those are pretty fragile.
also very fragile.
Yeah.
Small, tiny, witty thing. So those that can easily get cracked and get broken.
What got you interested in ears? Of all things.
You will laugh. You know, when I did my training, I never wanted to specialize actually. Because for me, I studied under the real apartheid system. The only place where a black child could do medicine was University of Natal. And it used to be called Black Section.
Yes.
So you'll go there in a class. We are 115 for argument's sake. And all 100 are either Indians and maybe 15, 20 are blacks. So when we got there, we knew very well that we're not here to play. we are here to study. So where was Steve Biko were and everything, we knew in the barracks, you could count bricks on your wall. So there was nothing to do but to study. So when I finished there, because then you were just studying to make sure I passed from one class to another. I mean, thankfully to the Homelands, then they gave us the bursary. That's the only way I could have studied, the vendor Homeland. And then when I finished, I said, you know what? I don't want anything. I want to go home and treat my patients, and that's it. After
Be
working,
a GP.
be a GP. After working as a GP for 2 to 3 years, I said, you know what? I don't know enough about anything.
You know little about everything.
Exactly. I said, I'm tired of giving sick note and this, and people come, they're just missing you, they just want to see you. You know,
Some it's therapy.
Some is therapy to see you.
I
I never thought about it. Some they come and just said, hey, you know what? I'm broke, man. Do you mind just to claim and give me cash?
Oh no!
I said, you know, my friend, I don't want to lose my license. Then after that, that's when I decided I must go back to specialize. Then when I chose the specialization, I had to say to myself, which is the specialization where we have fewer blacks? So I was good as an obstetrician. I did it for 1 year.
Yeah.
I loved it. And I did psychiatry for 1 year. I love it.
Okay.
I did general surgery. I love it. But I said, you know what? Obstetrician are there, black obstetrician. Gynecologists are there.
Remind
Peds
all of
are
us
there.
what obstetricians do.
They are the specialists for women disease and babies and pregnancy, gynecologists.
Yeah.
They usually call gynecologists.
That's okay. Yeah, that's the term.
That's the term that you're looking for.
Yes.
So then when I look, I said, ophthalmology, I said, no, I can't be eye specialist. I can't work with one organ. You mess it up, that patient cannot see.
Oh, no.
I said, no.
Well, they have another one.
And the worst thing is that people go for both of them at the same sitting to make more money.
Oh, no.
And they damage both of them.
Yeah.
So I said, there's ENT, ear, nose, and throat. Oh, that's interesting. They are male, female, adult, and children, and it has more disease. ENT is wide. It's not only otology. So there's otology, there's rhinology, there's laryngology, there's head
That's
and
why
neck.
even the name is divided.
Even
like
the
that.
name is divided.
Yes, yeah.
So I ended up saying, you know what, let me do ENT. And when I did ENT, I was the third black local ENT, early 90s.
What?
And I said, what? All these guys that I see are not local black South Africans. And I felt within myself it's my responsibility to train my own people.
So you were the first South African black?
The third.
The third, okay.
The first one is,
these are the two West South African.
is Nyoka and Sesiane.
You still know them.
I know them. They are my big brother. Nyoka, we talk all the time.
Wow.
And the rest other are blacks. They were not local blacks. When they finished training, our university, they were very good. This white university to get foreign blacks and train them. I don't know what they thought. So you'll see a lot of blacks and you think they are local. No.
They were not.
They were not. They train them. When they finish, they go all over the world because they have many passports. I said, but what about our own children? So that's when I came back to train. And luckily for those that I've trained, 5 of them, they are heading those training department from my hands. And I've trained more local blacks, both male and female, and whatever, white and Indian and colored than most university combined.
Incredible.
So I felt, look, I've done my part. You know, I can rock my chair and have a sip of red wine, you know.
But let's go back to your training. When you made the decision to do ENT,
yes,
did you find once you were there that you've made the right decision? Or did you question it at any point?
I found that I made the very right decision. And that's when I suddenly realized, wow, there's too much in ENT because in undergraduate, we don't teach them. They get exposure to ENT maybe at the most 1 week.
What?
It's only at the university where I train. During my time, we were only exposed for 3 days.
In that section?
That whole section, ear, nose, and throat. Only for 3 days.
Wow.
Whole 6-year training.
That's what I was about to say.
Yes.
6 years and 3 days are focused on that.
Yes.
Yeah. And imagine then it appears in the news, in the paper, rather in the exam, and you still fail it. So that means you didn't learn much.
But, in the exam, then they'll give you 4 lectures and they say only 2 they're going to come in the exam. So you need to read only these 4 questions. You know that only 2 are coming and you need only 50% pass.
You're good.
Then this exam. So they give you exam before, so you go and pass. But you know nothing about ENT.
Allow me to ask this question. In hindsight, now that you know this,
Yes.
and not only are you a practicing doctor in the space, but you're
Yes.
also a teacher.
Yes.
Do you feel there's more days that should be added to a junior doctor learning about these ENT?
Because most of the patient that the GP sees is ENT problems.
It's the throat.
Yeah, it's the throat, it's the nose, it's the ear. If they're pregnant, they know where to go. If they have broken bone, they know where to go. If the baby are sick, they know where to go. But this area, how often do you go? You go to the GP when you have flu. That is ENT area.
That
when
is
your
a
nose
throat
is blocked,
issue. Yes,
when
it's
you
a
are
nose
bleeding,
issue.
when you have tonsillitis, when you have blocked ear, that's where you go. When you have sore throat, that's where you go. But will you believe that even in their internship and their community service, they're not allowed even to rotate in ENT? So the GPs you see, they know nothing about ENT. Only when I started to teach the undergraduate now that I've been doing since 2000 and make curriculum, I sort of like modify it and give them enough exposure of things they need to see and they need to know it as a GP. Because I've been there.
Yeah.
I'm not sure if it's allowed from my experience. Anyway, I was not so. My first experience when I started to work in Venda and I was removing a foreign body in the ear, I did not even know how it was to remove it. I just put a tweezer in the ear and looked for something hard, looking on the ceiling, and I grabbed something. I said, this looks like a foreign body.
Oh, this feels like a foreign body.
In a 10-year-old child. And I pulled. Guess what? I yank all the bones. And then, so when I end up doing ENT, I said, maybe it's karma. Maybe I'm paying for the sins.
You're paying for the sins of your
That's why now I decided to say, we must do them with a 3D technology. So I've been stuck with the ear all my life.
Are you saying that one experience may have contributed to your decision making? Is it possible?
It's possible, yes.
That moment.
Because now I realize that, you know what? We don't know much about ENT and there are a lot of ENT problems.
Sure.
So the best thing is that let me go and specialize. And to be honest, I love the specialist and I'll go and do it. It's a nice specialist.
Yes.
You won't be very rich, but you won't be poor, but you live a comfortable life.
Yeah, that's enough.
And most ENTs are not proud. They are gently cool people by and large.
You know, it fascinates me how you say...
And they live long, by the way.
What makes them live
Because
long?
their life is not stressful. We have one ENT in the hospital that I work. He's almost 100 years old. He's still operating.
And he's got steady hands.
Steady hands.
Wow, look
You
at that.
meet him walking, he walks like...
And he's 100.
100 years old. He was on the newspaper not long, the oldest ENT who is still practicing. 100 years.
Incredible, eh? Do we
But
have many now? ENTs?
At least we have not many enough, but we have many where we have contributed. Because like if I say my trainees, they are heading other departments in other universities and myself. So we're training a lot. So the numbers are coming, but not where they're supposed to be. But they're coming. They're coming.
Do you know, I had a chat with Professor Mokokong.
Yes.
We sat for good 3 hours talking about life and everything else that comes with it. And his reference to his training is similar to yours, of University of Natal.
Yes.
Where it was the only medical school in the country.
Exactly.
And that's where all doctors were trained in a black school.
Yes.
Was that, were you getting the right type of education? And I say this very carefully because we're dealing with apartheid that was intentional about diminishing a black life. And now these doctors were trained to go and help black communities.
Yes.
Were you given the right type of education?
We were the best trained doctors.
Wow.
That's why we could go anywhere in the world and still be the best. So interesting enough, so the person who came with that that blacks are not trained. They need to be trained. So you must remember that in the postgraduate, there were still white students, so they were still there in the section, but the undergraduate were there. Okay. So all the blacks and the Indian, whatever, they gave us good training. But we ourselves, to be admitted in medicine those days, you have to be good.
Are you saying at matric level?
At matric level.
Just before you become that?
Yes.
Before you get into the
medical school.
Medical
so
school.
Most of the people did a lot of pre-med, where you go and do maybe BSc in other universities, University of the North, TEFLOP, Zululand and whatever. Then reapply. Then you get a chance because the space was small.
I have a tea issue. Do you mind if I cough?
No, you have reflux.
What? So you can even diagnose what I'm
diagnose you. You have a reflux. You can cough. It's your studio. I have no problem.
So you can tell what I'm going through. Yeah. You're like a traditional healer. Like I can tell what you're going through.
No, I'm a spiritual.
I must lose. Your people say you must cough. All right, let me cough it. That's funny. It's the first time I cough.
I've not even drank my
It's
tea.
cold by now in this air-conditioned room.
That's why we have an iced tea.
Yeah, well, I guess. Yeah, it's iced coffee. Jeez, man. First time I cough and somebody can tell what I'm going through. Okay. So
you need treatment. You must come to ENT.
So a tea situation. Wow. I'm curious to understand that the number of doctors that were able to be produced.
Yes.
By University of Natal.
Yes.
With that clear intention.
Yes.
Were they in decent numbers at the time?
I mean, to show that we're not so many in that residence where only blacks were there, including everyone from first year to sixth year, including all other degrees, law, commerce, and what, were only less than 700 students.
The whole school?
The whole school. So it made us...
So as doctors, you're probably 50.
Maybe, I mean, it's first year to sixth year. So maybe if let's say 20, 30, yeah, we're somewhere there around 300 or so.
Yes.
300 from first year to sixth year. But the thing is, we were very focused in our mind. We understood that it was, a luta continua. We were cognizant that we were there for the emancipation of our people. We're cognizant that we must study hard, that when we go back home, we'll be able to treat our people.
Yeah.
So we'll read books from cover to cover.
Sure.
And we say in between, we'll have enough information to be able to pass. So even if you go there, they give you 50, as long as you have passed.
Let's
all you
move.
look, oh yeah, I've passed.
Next.
Sharp.
Next level.
Next, until you finish.
Sure.
So it made us that we were very good doctors because we wanted more. And yes, when they chose the cream.
Of course.
And interesting enough, I mean, they trained good doctors. I mean, we were just sharp. To an extent that early days, I'm not sure if it was during your time, when you have a GP, you ask, where has he trained from?
And if there are certain schools.
There are certain schools where if he has trained there, you don't go.
Uh-oh.
So when they know that he has trained from Natal, actually we used to call it Wentworth. And Wentworth is just a colored township next to where the barracks was. So if you have trained in Wentworth, then they know that you know your stuff.
But isn't a doctor training fairly standardized?
It's not standardized. Yeah.
It's not standardized across the schools.
No. So you can't move from one university to another, no.
Why isn't it standardized at this stage?
The points that the health professional council want, they are standardized, but the teaching methodology is different.
You're likely to write the same exam.
You don't write the same exam in undergraduate.
Okay.
And after second year, so the first year and second year, they don't have a problem. But now it has changed so much that you can't even move from one university to another. Before, So the first 3 years were basic sciences.
Okay.
So you can do until third year and maybe move to another university. It was possible. After, as the years goes by, you can't move from one university to another. If you are in the University of Sfakomakati, you must finish there.
Yes.
You can't go
You'll struggle to...
No,
they won't even accept
They won't
you.
even accept you.
Huh.
Because they'll say, we don't teach this way, or we have not taught these things. So with us, by third year, you are fully doctor. Fourth year, you are starting to see the patients, but all the knowledge is in your brain.
It's not practical.
It's now practical.
Yeah.
So whereas there are some that, you'll be doing practical until you finish sixth year. So at sixth year, you still not, when you finish, you are not a fully cooked product. That's why they have to have 3 years. For us, when you finish the 6-year exam, Monday to Friday, you are doing everything in which you have studied in 6 years. When you finish on Friday, 3 o'clock you go on the wall and your name is there. You are fresh from the box. You can go and treat the patient.
And this you're referring to back in the days.
Back in the days.
Yeah.
Not now. Yes, of course, maybe the classes were smaller, but now the classes are big and the facilities have not changed that much. So it becomes a little bit difficult because medicine, you need to see the patients.
Yes.
But it has changed a lot.
You've done pre-med, right? University of Venda.
I did pre-med at University of Venda because I could not get chance to go to University of Natal straight away.
What was circumstances?
Finance.
Ooh.
And then so because I was so determined to do medicine, University of the North was when the University of Venda started, because it started when I was doing grade 12, University of Venda. Then they were starting to accept people to do basic science, BSc, come pre-med.
Okay.
So I said, okay, let me start pre-med here and keep on applying to Natal. And thanks God, when I finished, my exam results were not so bad. University of Natal took me straight away to second year.
Okay. You didn't start from the beginning.
I didn't do first year in University of Natal.
Yeah.
I was at second year, the most toughest year in medicine.
Second year.
Second year.
What makes it tough?
It's because there's a lot of things that you need to learn. That's when we learn the whole human body. From top to bottom, everything.
Yeah.
Anatomy and physiology.
God's creation. One of God's great.
And microbiology.
Sure.
That's when we learn everything.
All the terminologies.
All the terminology. If you don't make it in second year, you will never make it in medicine.
Is there a high rate of it's a very
of attrition? Very high.
It's a
rate
leading question, is it?
High rate of attrition. Second year medicine. High attrition.
And it's probably where your muscle is truly tested.
Exactly. So we used to have a saying that since I gave up hope, I feel so good. In other words, since I gave up hope that I'll get a prize, I feel so good. All that I want, I just want to make sure I'm passing second year, third year, fourth, fifth, sixth. And then when you go on the wall, oh, your name is there. Go and take your bags. I'm a doctor. And you leave. We used not to graduate even. I'm sure he told you. So during my time, it was the current Minister of Health, people like Joe Pacha, Dr. Joe Pacha.
Yes.
All these guys that are in government now.
They were studying.
They were our seniors.
Wow.
Just there towards
you were Mohokong had already passed.
Mohokong was one of the gynecologists.
Oh,
but by then when I went to Natal, I was coming to start Medunsa.
Oh, yes.
He just examined me. When I did
so you did have an encounter.
When I did 6th year, he examined me.
Wow.
And only when I came to specialize, because I could not be accepted anywhere in the whole country, because I'm a local South African, then I end up saying, okay, look, if I'm accepted in Medunsa, let me go there.
Are you saying to study or to...
To study the postgraduate now as a specialization.
It wasn't that easy for you to get in.
It was difficult. That's why I said I was the third local black.
Well, I thought by then they were accepting of blacks.
No. They were accepting of blacks, but not local.
Jeez.
So UCT... And Stellenbosch and Free State were the worst. You'll see black faces and you think they're local. You talk to them, they're foreign guys.
Whoa.
Oh, it was tough, my friend.
How did you overcome that?
Resilience and understanding that the struggle continues. You need to be a trailblazer for the sake of your people.
Yeah.
So you have to sacrifice all the pleasure. And I mean, when I finished, I did a bit of private practice for 1 year. Then they called me, they said, please come back. We have no head of the Department of University of Pretoria, University of Medunsa. I decided to say money or go back and train. I said, if I stay in private practice, I'll just make more money, break more hearts, more women. But
rather not.
I said, you know what, let me go back and train.
Yeah.
And I'm the happiest. I have no regret.
Amazing.
Yes.
The transition from training doctors to practicing doctors, your observation from back in those days and now, do you find that young doctors struggle with this transition of being a student who just reads things through the book and then becoming a practical doctor who has to touch people's bodies?
Of course.
Is it a tough transition?
Completely. Because even the throughput at grade 12, it was better when it's matric.
Really?
Yes.
Never.
It's true, Scott.
How have we messed things up there?
You can ask that question again. So that's why even the university, they don't admit the student at the university based on grade 12 marks. The grade 12 just affirm what may be 11 and 10 you were performing. So they take
11 and 10?
Yes.
Into account.
You have to be good at 11 and 10. So whatever you get, as long as you get an exemption in 12, you'll go to medicine.
Good enough.
But if you're bad in 10 and 11, all of a sudden you get distinction in grade 12.
Well,
who gave you the script?
Wait a minute. I found Jesus. I woke up from the slumber.
Somebody has given you the marks or they sanitize the marks.
Help me understand that.
Yes, they sanitize the marks they have more distinctions.
No, not the sanitization. But why is 11, it's 10 and 11 so important in that
Because
regard?
by then, you are not striving for anything. If you are good, you are just good.
Okay.
You are honest.
It's not the Olympics.
It's not the Olympics.
Yeah, you're just
good. So
you're running with your friends at home.
They check your track record.
Got you.
You can't just say all of a sudden you are one night wonder. No.
It happens. I must admit it happened with me, but it wasn't matric.
Yes.
It was standard 6. I was standard 6.
Yes,
so you know,
Form
1.
Yeah.
Yes.
Yes.
I failed first, second, and third term.
Yes.
And I remember the moment so well. I was number 24 or something in class of 32.
Yes.
And I was, that day we fetched the results. It was on a Friday. When you go fetch the results, a half day.
Yes.
And then they give you a report. And then I opened this report.
I remember we used to open, it's written everything.
It's written, everything is there. Yeah, I had performed so badly. And there was this guy, David Molapo.
Yes.
It was one of our friends. He was going to a much better school than us, Christian Brothers College. Yes. And he was just there hanging around.
Is he there with the doctor?
No, not that doctor. There's another David Molapo.
Because that one is a PhD.
Yes.
Passing higher grade with difficulties.
There you go. But it's not that one.
Okay, yes.
So I remember opening my report card and he sees it. And his words were, you're going to fail, Moswena, this term. Or rather, this year. You're going to repeat this year. Note, it was third term. It was just before the final exam.
Where we used to put it trial.
Exactly, absolutely. Yes. The one just before.
Yes.
If you fail this one, you're not likely to make it.
Yes.
All right. I remember that moment so well. It changed my life forever. I've been that person ever since that.
Wow.
We used to play soccer a lot. And we used to enjoy our lives. We were now in high school. We were these, older,
care. Yeah,
you know what I mean? Yes. But we used to play soccer quite more than we were supposed to. And I stopped hanging out with my friends from that moment, and I have not changed. I've been the same person ever since. And I passed. I moved from number 24 in class to number 3.
Congratulations.
All I did was just study.
Which is what we did at medical school.
Yes.
You study, you eat, you pray, you play soccer,
If you get
and
a
you
chance.
sleep. No,
Yes.
there we used to play soccer. I mean, there was no entertainment anyway.
Yeah.
We didn't even have TV like now. There was only one TV room where we all there go and look, and then you go away, where we used to watch MacGyver and all funny stories. But you just say, you know what? I have to work hard.
Yeah.
So I tell people that I'm not intelligent. Maybe I don't understand intelligentsia. I must study something 3 times. The first time I just go over it. The second time I'm trying to understand the concept deeper. The third time I can, rehearse it in my mind without looking at it. So I tell students that know your retention strategy. There are guys that they won't read. They will hear you speak and they keep everything in their brains.
They remember.
Me, no. I must listen and write and go and check.
I think you are quite normal.
And read again.
A lot of us are like that.
Yes, and read again. Then from there, then I understand. So that's why I said you just need to have a good brain retention and work hard. And that's what I did.
Is it true that you were once told by a teacher that you were not going to make it? You're not smart.
Yes. I was doing standard, now it's grade 5. I was doing standard 3.
What were the circumstances that led to this teacher
then
saying
they
that?
used to have a period which they used to call it career.
Yes. The guidance.
Career guidance. I'm sure now they call it life orientation, whatever they call it. So the teacher will ask each one. They were not teaching us anything. They just said, hey, what do you want to become? A teacher, a police. I want to be a husband, a mother, a what.
Yes.
A security. So I stood up. I said, I want to become a doctor. She said, you're too stupid.
But how would they have made this assessment?
You'll never be a doctor. I used to beat your brother at school. So who are you? You're not intelligent enough.
Oh, no.
But those words, somebody asked me, I think they asked me on 702, and somebody comes to me and said, you are talking like somebody who is angry. I said, no, I'm not angry. Those words motivated me to want to prove to myself, to that person, and also to have a philosophy that as teachers, we don't have the crystal ball. We can't measure, studying school, it's boring for intelligent people because it's parrot, it's just repetition. If you reproduce the garbage that I've given you, we give you a star. Where is the intelligence there?
You retain, you regurgitate,
and then
you're smart.
There's no smartness there. So we're just being made to grow, to be matured, to be 16, 17 years when we finish. That's all.
Yeah.
But the bright brain will think of the solution without sitting through a classroom. Because they're intelligent. Everything that is there, is put by a person and a certain way they want you to think. So they're indoctrinating you in other words.
So you're saying the measure is fundamentally flawed.
Completely.
Yeah.
That's why I love the school that allow the person to be measured by how they're progressing with their intelligentsia and problem solution. I make a joke, which I hope is appropriate. I said, the cell phone we use and think we use, the kids may be in China, they are doing them as homework. They sit down and said, kids, hey, open this cell phone and look at everything and create another one. We will still have to finish grade 12 and then start to innovate. It's too late, man.
You could have invented your invention years before.
I don't have that. I have many inventions. You spoke about the earbuds. I've invented something more safer than that.
What?
I have 12 of the best.
12 patents.
Yes.
I thought it was 1 or 2.
No, I'm not a one night wonder.
Tatela pads.
When,
I'm taking it away.
and I tell the student, I said, even the books you are reading is trial and error. Everything that you see, like operations, I change my operation all the time. I said, somebody tried it and it's end up say it works. I said, this works in my hands. So a sister cannot work with me and she go somewhere for 2 months. When she come back, she'll find that the same operation I've changed how I do it.
Whoa.
Because I'm an innovator.
Yeah, you keep thinking, maybe not.
Yeah, I keep on saying, no, maybe not. It can be done better.
Jeez.
So I'm surgically gifted and I'm innovative. My ways of doing things change all the time. That's how my brain works. I can't do repetition. Repetition is boring for me.
It goes back to what you were saying earlier about the teaching process of young people in school.
Yes.
The system is exactly that. That's the problem.
Yes.
It teaches you to remember the same thing. If you were taught the wrong thing, you remember the wrong thing forever.
Forever. And then when you grow and you start to research, you say, no, that theory they gave us was wrong. And most of them, they get rechanged. You say, no, that formula, it was wrong. Yes. So, you know, you have to believe that you have what it takes and you can think and try to look for solution all the time. If you can't do it this way, try. What about this way? Me, I don't, and I get frustrated if I can't solve a problem.
Jeez.
So that's how it was with me, with the maths. I will not go home if I'm trying to solve a X and I'm struggling. I said, no, this thing has been said by a human being. I'm a human being. I can crack it.
Just keep going.
Keep going and look and think. And then I come with a solution. I said, this is a solution.
And it gets worse if other students can crack it and you can't.
I said, if somebody can crack it, I can crack it. So in medicine, that's how it was. So when you're in first, second year, third year, and it's tough, but you see your guys are in fourth, fifth years, you said, if somebody has passed, it means I can pass.
Yeah.
So in other words, I challenge myself by seeing what other person they are doing, that it can be done. So when I say innovation, yes, I've done what I've done, it means that everybody who think deeply can come with a solution.
During that time when you're told that you're not very smart, some people would take that, internalize it, and believe that they're not smart.
Yes.
How is it that it didn't work that way for you?
I think for me, I don't know how, but our mother always encourages us to study and to learn. So I did not care who calls me what. What matters is what you respond to. I mean, you know the famous thing that you are a dog. And then somebody said, do you see a tail? I don't have a tail.
No.
Maybe you are mad because you are seeing a dog, whereas I'm not a dog.
You're the problem.
You have the problem.
Yes.
So when you call me that I'm stupid, I'm not intelligent, I said, my friend, it is your own assessment. Maybe you are sick. I am intelligent. I have what it takes. So I don't keep it. I said, I brush it off.
It takes a measure of resilience, though, to be able to overcome the mighty words of a teacher. You know how the mighty words of a teacher.
But even then, immediately I said, no, she can't dictate my life. So now when I teach students, the first thing when I got into the class, I meet them at fourth year. I said, congratulations for being admitted at this university, for being in fourth year, for being the cream of the earth.
That's when they get to you.
That's when they get to me at fourth year.
Yeah.
I said, don't believe whatever we, the professor and teachers, tells you. The only thing we know is medicine. You are better than what they say because I'm thinking of what I was told.
Jeez.
So even when I teach student or postgraduate or whatever, I said, you can make it. So when the student come first year postgraduate and they finish, and specialist, and they pass, I feel like I was writing an exam. I get so excited because I'm defying, the words that was told.
You still hear those words?
Oh, not really. Not anymore.
But you did for some time.
That's why I still remember them even now.
Yeah.
So even when I finish, you I'm not sure how much time you have. So when I finish grade 9, the teacher who was a science teacher to be able to go to medicine left the school and was promoted to become a principal. I left the school and go and look for a school that teaches mathematics, science, and physical science because I knew that I needed them to go to medicine. I have to go and look for a school. And I went to different schools, maybe there's a school in Venda, Mbiri, which was one of the best schools, but they used to take the cream. I went there and I was told off that you're stupid. Don't even come in here.
Oh, no.
Then I went to another one called Demanding Agricultural High School. When I walk in there, a white man, he was young, bald, and I just walked into his office. He said, what do you want? I said, no, I want to enroll here. He said, okay, there are 5 classes there, 1, 2, 3, go to number 5. Just go and sit there and enroll and that's it. That's how I got to the new school.
Didn't ask you much.
Nothing much. That's where I did my grade 12. Then to get the subject to be able to go to the university. When we did trial, those who were in class 1, all of a sudden they learned that, hey man, only small boy there in class number 5.
Yeah.
Because I was beating all of them.
Sure. And what was at that moment, what was your secret to beating them?
I think I love knowledge. So I love reading. I love studying. I love researching. I can spend time reading. I was impressed when you say you listen to audiobooks.
Yes.
I love reading. I love knowledge.
Yeah.
So I can spend time. The best place where I enjoy in my house is my library. I love knowledge. I love new things.
You're curious.
Very curious.
Yeah.
So the brain is just somehow, I'll look and look. I mean, the first time when I listened to the radio, I said, I have to open it. I said, but there's no one here. But they're talking.
We're all curious. I guess.
So curiosity is my life and it keeps me going. And the other thing is self-belief.
Yeah.
I learned very early that I'm wonderfully and fearfully made. And the one who created me looked at me and said, it is good. Yeah. So I don't care who says what.
This one is
so
all
that personal confidence within myself. So whatever they say, I said, let them talk.
You said it comes from home, that state of mind.
Yes.
What is the importance of that state of mind in most families and most parents to bring to the house?
You must acknowledge your children that they are bright, they are intelligent, and they are able and they are capable. Don't tell them they are stupid, they are foolish, they will amount to nothing. I don't use that word to my students. I was trained, even some of my teachers used to insult us and tell us that you're stupid. I don't use that word at all to any student. If they don't know, I just said, please go and read. You'll find it where. But I've because the thing is, the secret of the thing is, being a student is temporary. It's bound to change. And in my life, it has happened. My boss now at the hospital was my student.
No way. In Pretoria?
Yes. Yeah. And then she became a postgraduate in my university. Now she's my boss. I must respond to her.
Hey, that's how life works.
That's how life works. So if I could have told her, you are stupid, you are foolish, then she would be negative to me. So that taught me a lesson that no, whatever you see is temporary. Being student is temporary. This person could be a boss, could be a president, could be a leader tomorrow.
Could be anything.
It could be anything.
Yeah.
So even if it's a security man or a cleaner, respect those people.
So the importance of the household, though, because to develop that muscle of belief, of self-belief, it starts very, very young.
Very, very young. So my belief is to expose children to the highest possibilities. So in other words, if you go to meetings, take them along. You travel overseas or wherever, take them along. Let them see what else is there. Give them books, give them material. I was very excited when my daughter phoned me and said, Dad, I want a membership for exclusive bookshop. so that
Okay.
every month I must get a new book. Because when she was young, I said, read. She didn't like it. Now she's the one who's reading because she saw me reading.
Yeah.
To the extent that people say you're a bookworm. I said, yes, I'm a bookworm.
Rather that.
Rather that than sitting and watch TV. Because for me, when I watch TVs or things, it's not fair because I suddenly said, these people are playing with our mind.
They're lying.
They're manipulating us. Eh?
Yes.
Everything is a set. It's set, like, okay, he's hiding. They know where is what and what. This is a story. Yes, of course, I watch it just to see, okay, what is the new trend?
What is the new trick?
Yes. The new trick. Oh, yeah, I can see what they're doing. But immediately I said, these people, they're playing with our minds. It's somebody else's mind acting it out.
King David Studio Podcast.